Good morning, good day, good afternoon. Hello, this is Jared, and this is the Spectrum for Monday, May 11th. The goal here is simple. Let's slow down the news cycle and separate what has been confirmed from what is still unclear. And our focus is really what affects ordinary people today. So in today's episode, we're going to start with 3 pressure points in daily life: student loans, consumer confidence, and the job market for younger Americans. Let's get started. The Education Department, well, to get us started, we're going to review what we're going to cover today, and then we'll also dive into those stories. The Education Department has finalized a rule that changes borrowing limits and repayment options beginning this summer. Consumer sentiment has fallen to a record low, and energy prices and personal finance worries keep weighing on households. A new Gallup poll shows young Americans are much less confident about finding quality work, even while top-line unemployment remains low. Then we'll move into health, courts, and public safety, because the Supreme Court has a same-day deadline on mifepristone access. 17 U.S. cruise passengers are returning for hantavirus monitoring in Nebraska after a deadly outbreak. The CDC now reports more than 1,800 measles cases across 39 jurisdictions. And Monday's weather map includes severe storms, flash flood risks, fire weather, and western heat. We'll also cover raw milk policy fights, FDA action on psychedelic drug review, Tennessee redistricting, and the final day of the Russia-Ukraine ceasefire window. My name is Jared, and this is The Spectrum. The U.S. Department of Education has finalized a rule that says it will lower college costs and simplify repayment. The rule begins implementation this summer. It includes new borrowing limits for students and parents, it simplifies repayment options, and it creates a new income-driven repayment plan authorized by Congress. It adds protections the department says are aimed at students, families, borrowers, and taxpayers. The department says federal student loan debt has reached nearly $1.7 trillion. It also says less than 40% of borrowers are in active repayment and nearly 25% are in default. The actual news here is not just that a rule has changed. The real question is how the rule changed decisions for students and families. Loan limits can reduce the chance that people borrow more than they can repay. But loan limits can also make it harder for some families to cover tuition at higher cost programs. Repayment simplification can help borrowers navigate fewer plans, but the details will decide who pays less, who pays more, and how schools respond. So what is confirmed? Well, we know that the final rule begins this summer and includes borrowing limits, repayment simplification, and newer income-driven repayment plan. What is not yet confirmed is how borrowers in different income brackets will be affected after implementation. It's also unclear whether colleges will lower prices, increase aid, or shift costs somewhere else. The gap in coverage is that official announcements often talk about borrowers and taxpayer in broad terms. Students need plain language examples, such as what changes in monthly payment, what changes in borrowing access, or for parents, or even for graduate students. The concern here is that changing loan rules can either make colleges more manageable or make financing harder, depending on the student and the school. Students from families without savings are exposed. Parents considering Parent Plus loans are also exposed. Even borrowers who are already struggling with repayment are exposed. Fairness is what's at stake here, because the same rule can protect one person from over borrowing while limiting another person's options. The implementation guidance from keep an eye on implementation guidance from the department and find out what loan servicers are telling to their borrowers. We can also pay attention to whether colleges will change pricing or even their aid packages. And watch whether students also get clear information before they have to make enrollment decisions. The spin to watch for is treating the rule as purely borrower relief or purely access restriction. Really, the better question after all of this is who ends up with lower risk and who loses flexibility. The second story here is about consumer confidence. CNN has reported that the University of Michigan's preliminary May consumer sentiment reading has fallen to 48.2%. Now, this is the lowest level since records began in 1852. The decline comes as consumer report concerns about energy costs, personal finance, and inflation are all on top of mind. This connects to the broader energy picture. The Energy Information Administration has reported significant increase in crude oil and petroleum products in the first quarter, tied to the Middle East disruptions and the de facto closure of the Strait of Hormuz. Consumer sentiment matters because it can change behavior before official economic data actually fully catches up. If people feel financially unsafe, they may delay purchases, they might reduce travel, they'll avoid taking on additional debt or even postpone home buying. They may even cut back on even discretionary spending. Some of the coverage that's out there treats consumer sentiment like a political mood. But mood becomes economic activity when millions of households change choices at the same time. Now, what we know of what is confirmed from this report is that the preliminary May sentiment reading has hit a record low. And what is also confirmed is that energy costs and personal finance concerns are a part of this pressure. What is not yet confirmed is whether the pessimism will turn into a major spending pullback or whether sentiment readings will be revised. Some people also keep spending even when they feel bad about the economy. So the gaps in coverage over this subject is that political elements often treat this sentiment as a scoreboard, where the real question is, what are households cutting? Are they delaying repairs? Are they skipping trips, using credit cards more? Or are they wanting to move? Are they pulling back from small businesses? The concern here is that financial fear can shrink people's choices even before a recession shows up in the data. Families with tight budgets are the ones who are exposed. Commuters, renters, people carrying high interest debt are all exposed. Trust is what's at stake here when official economic strength does not match household anxiety. So you can pay attention to who's spending on retail, how high credit card balances are, even delinquency rates. Keep an eye on gas prices and utility costs because those are daily signals that people feel immediately. Now, when it comes to the media coverage, the spin to watch is for those who are treating bad sentiment as irrational when people are simply responding to real bills. The practical question at the end of the day is whether households feel safe enough to keep participating in the economy. Young American job market optimism falls. This next story is about the job market, especially for younger workers. AP reports that younger American confidence in the job market has fallen sharply while older adults remain more upbeat. Gallup found that only 28% of workers say now is a good time to find a quality job. This is down from 70% in mid-2022. This matters because a low unemployment rate does not always mean that people feel opportunity. A worker can technically have a job and still feel stuck. A recent graduate can see low employment and still struggle to find an entry-level role. A young renter can work full-time and still feel no closer to stability. This story helps explain the gap between top-line economic data and the real lived experience. If hiring slows, openings shrink, entry-level roles disappear, or AI changes career ladders, younger workers, they can feel locked out, even while older workers feel stable in existing jobs. So what is confirmed? Well, we know that the Gallup poll shows a sharp drop in the job market confidence. What is not yet confirmed, though, is exactly how much of that pessimism comes from hiring conditions, AI anxiety, the cost of living, or even just a political mood. Polling captures perception, not a guaranteed outcome. But perception matters. When people are deciding whether to move, to change jobs, go back to school, or start a family, or even take on debt, and that means that the gap in coverage on all of this is really just highlighting that job coverage often highlights unemployment. And unemployment does not show everything. It doesn't show the hiring freezes. It doesn't show fewer openings. It doesn't reflect the weaker career mobility. It does not fully show whether young people can actually get a quality job. So the concern here is that young workers may lose confidence in the basic promise that effort leads to opportunity. Recent graduates, early career workers, renters, these are all people who are exposed to those challenges. People without family financial support are the ones that are also exposed. And of course, dignity is what's at stake, because work is not only income, it's identity, independence, future planning. So keep an eye on job openings or watch quits. Watch the hiring rate or even entry-level positionings. Even internship to job conversions all help understanding the full conversation. Will AI adoption reduce junior roles? Well, the spin to watch here is saying that the job market is fine because unemployment is low. Really, the practical question is whether people can find a quality job, not just whether they technically have one. The Supreme Court mifepristone pause expires today. This is in the lineup because today is the deadline. Justice Samuel Alito issued a one-week administrative stay on May 4th. That stay temporarily restored nationwide telehealth and mail access to mifepristone. It blocked a lower court order that would have required in-person prescribing and dispensing while the case continues. The stay expires at 5 p.m. Eastern today, unless the Supreme Court acts again. The case was brought by Louisiana against the FDA. The drug has been used by more than 7 million U.S. patients since FDA approved in 2000. The real story here is about legal uncertainty. If the court acts, access rules may remain stable for now or change in a more narrow way. If the court does nothing, restrictions could take effect quickly. Patients, telehealth providers, pharmacies, and manufacturers may have to adjust fast. Some coverage focuses on abortion politics. This is only part of the story. The practical issue is that the court timing can become healthcare timing, and that matters for abortion care, for miscarriage care. What is confirmed here is that the administrative stay expires today unless the court acts again. What is not confirmed is whether the court will extend the stay, narrow the order, or allow restrictions to take effect. And it's also unclear how quickly pharmacies and telehealth providers would be able to adjust to those changes. The gap in coverage here is that the legal procedure can hide patient timing. A court deadline is not abstract for someone making a medical decision now. Really, the concern here is that healthcare access can change faster than people can realistically respond. Patients without nearby clinics, people without transportation, people with paid time off or needing privacy are all the ones who are exposed to these. Trust is what is at stake when medical rules shift by emergency order. So pay attention to the Supreme Court docket before 5 p.m. Watch whether providers pause services simply out of caution. And pay attention to whether any order is a national or a limited order. Really, the practical question here is whether patients can get timely care under stable rules. U.S. cruise ship passengers return for hantavirus monitoring. NPR reports that 17 American cruise passengers were expected to return to the United States for evaluation after time aboard the MV Hondios. That ship had been linked to a hantavirus outbreak. The passengers were expected to be evaluated at the National Quarantine Unit at the University of Nebraska Medical Center. The wider ship group included nearly 150 people from 23 nations. At least 8 confirmed cases and 3 deaths have been reported in the wider outbreak. This is not a mass panic story. It's simply a public health response. Hantavirus can be severe, but the public needs proportional information. So, who's being monitored? How does the transmission work? And what symptoms matter? How are officials communicating with local clinicians to the public? What is confirmed is that 17 U.S. passengers were exposed to return for evaluation and monitoring. What is not yet confirmed, though, is whether any of them will develop symptoms, and it is also unclear how many people had meaningful exposure. The gap in media coverage is that the word quarantine can trigger pandemic-era fear if the risk is not explained clearly. But the opposite problem is also real. Official communication can create distrust. The concern here is that rare disease responses require clear communication without panic or minimization. Passengers, families, ship crews, clinicians, and local health teams are all the ones that are exposed to this story. And trust is paramount. It's what's at stake when people cannot tell whether officials are being careful or withholding basic information. So pay attention to whether any monitored passengers develop symptoms, or if the CDC, the state, and the UMC provide any updates. Watch whether clinicians receive clear diagnosis guidance, because this is a test of post-COVID public health credibility. Really, the practical question here is whether the response protects people while keeping the risk in proportion. The CDC reports 1,842 measles cases across 39 jurisdictions. This is an update based on data from May 8th, with data reported as of noon, May 7th. These cases are across 39 jurisdictions. The CDC also reports 12 cases among international visitors, and 93% of the confirmed cases are outbreak associated. This remains in the lineup because the official count that has changed. The public interest angle is that community disruption. The public interest is that there is community disruption. Measles affects schools, childcare, clinics, and vulnerable relatives. Local health departments that have to trace exposures and manage isolation guidance. What is confirmed is that the information has been updated by the CDC. What is not yet confirmed is how much the count will change in the next update. Local exposure chains remain under investigation, and it's unclear how much additional strain schools and health departments will face. The gap in coverage here is that vaccine politics framing can vary operational burden. School nurses, pediatricians, families all have to respond. Public health teams have a responsibility to communicate clearly. The concern here is that ordinary places simply can become exposure sites. Infants can be exposed. Immunocompromised people can be exposed. Unvaccinated children are also exposed. Safety and trust are what's at stake because containment depends on shared behavior. So let's pay attention to what the CDC updates, as well as what hospitalizations, how many are happening, and who is it happening to? Does it affect other areas or other school and child care guidance? Because this is a public health capacity story, not a vaccine story. The practical question is whether local systems can contain the spread before daily routines are disrupted. Monday weather map shows storms, flash flooding, and fire weather and heat. The National Weather Service says isolated severe storms with damaging wind gusts and hail are possible from the coastal Carolinas into the Florida Peninsula and along the central Gulf Coast. Heavy rain may cause localized flash flooding along the Gulf Coast. The National Weather Service also warns that gusty winds, dry conditions may create elevated. The National Weather Service also warns that gusty winds and dry conditions may create elevated to critical fire weather across northern and central plains. And record heat is expected in the west. This is broader than a single storm zone. Monday's map includes severe storms, flooding risk, fire weather, and heat. Some coverage focuses on tornado possibilities, but the public interest issue is daily disruption. Disruption from travel, outdoor work, power outages, or even air quality can affect everyday life. Wildfire readiness and heat exposure are also serious concerns. What is confirmed so far is that the National Weather Service is flagging multiple hazards across multiple regions. What is not confirmed is exactly where the storms will intensify, where flooding will repeat, or whether fire weather turns into active fire. Any gap in coverage here is one that can create a hazard and dominate headlines while other risks get less attention. The concern is that weather risk affects people before it becomes disaster footage. So be ready to make changes. Pay attention to alerts from the National Weather Service and your local coverage. Make sure you have emergency equipment available, such as charged phones, a shelter, or even an evacuation plan if needed. And if you're in the West, stay hydrated because heat precautions really matter. The practical question on this is whether people in affected regions can adjust before conditions deteriorate. Raw milk policy push grows despite outbreaks sickening children. AP reports that raw milk advocates are pushing to make the product more widely available even as outbreaks sicken children. The Associated Press found that more than 36 bills supporting raw milk have been introduced in state houses nationwide. AP also reported a separate E. coli outbreak linked to raw milk cheddar cheese that sickened at least 7 people across 3 states, including small children. This is a food safety and state policy story. The debate is often framed as consumer freedom versus regulation, but the public impact issue is that children can be exposed through adult choices and local markets. The factual question is not whether people distrust industrial food systems. The factual question is whether policy changes increase access faster than safety systems can prevent outbreaks. What is confirmed is that there is a national policy push for raw milk access. What is also confirmed is that outbreaks linked to raw milk products have sickened people, including children. But what is not yet confirmed is how many bills will become law, whether new state rules will include stronger testing, labeling, or traceability. And the gap in coverage in this is that freedom versus regulation framing can underplay child risk. Coverage might quote advocates and officials without simply explaining how pasteurization changes that risk. Small farms and local buyers deserve coverage. So do families affected by the outbreak. And really the concern here is that food policy choices can expose children to preventable disease, which means children, pregnant women, older adults, and immunocompromised folks are all the ones who are exposed. Small farms are also exposed to reputational and legal risk. Trust is what's at stake because consumers need clear information, not slogans. So pay attention to the state bills, whether they include testing and labeling requirements. Pay attention to the CDC and FDA outbreak updates, and watch whether retailers, herd share programs, and local markets expand access. The practical question here is whether expanded access comes with enough protections for the people who bear the risk. The FDA moves to accelerate the review of psychedelic drugs. The FDA has announced actions to accelerate treatments for serious mental illness after a Trump executive order. AP reports that the FDA plans ultra-fast review for 3 psychedelic drugs being studied for difficult mental health conditions, including depression. The White House says the policy is aimed at accelerating access to treatments for serious mental illness, including treatment-resistant conditions. This is both a mental health access story and a drug safety story. For faster review could matter for people with treatment-resistant depression, PTSD, or traumatic brain injury. That includes veterans and families supporting people in crisis. But accelerated review also raises questions. What evidence is enough? What safety protocols are required? Will supervised administration be mandatory? What side effects need tracking? And will ordinary patients actually be able to gain access to treatment if insurance does not cover it? What is confirmed so far is that the FDA announced steps to accelerate action on treatments for serious mental illness. What is not yet confirmed, though, is which drugs will ultimately meet FDA approval standards. It's also unclear what safety protocols, supervised use requirements, or risk management rules will apply. The gap in coverage here is that groundbreaking treatment framing can underplay evidence and safety concerns. Culture war framing around psychedelics can also obscure real patient need. The concern is that desperate patients need both faster options and stronger safeguards. Veterans are really the ones who will be exposed. People with treatment-resistant depression or PTSD, or families who are supporting people in crisis, are all ones who are exposed. Dignity is also at stake because mental health suffering is real, but hope should not outrun evidence. Therefore, pay attention to FDA trial standards. Watch advisory committee reviews. Watch whether approvals require supervised administration. Insurance, will they be covered? Will they provide clinic access? Watch whether marketing runs ahead of the evidence. Really, the practical question is whether patients get credible help, not just faster headlines. Thank you for tuning in. That is today's Spectrum. The through line today is systems under pressure. Student loans are changing how families plan for college. Consumer confidence is showing how financial fear moves through daily life. Younger workers are questioning whether the job market still offers real mobility. The Supreme Court could change healthcare access by the end of the day. Public health teams are managing hantavirus monitoring and a growing measles outbreak. Weather hazards are stretching across storms, floods, fire conditions, and heat. State legislators are weighing raw milk access while outbreaks raise child safety concerns. The FDA is trying to move faster on serious mental illness while still needing safety standards. And that is today's Spectrum. The goal is not to make every story feel like a crisis. The goal here is to ask what is confirmed, what is unclear, and who is affected, and what viewers could do to pay attention and watch what's next. For full sources and full phase 1 briefing of all the information provided here, you can use the link in the description below for all of that research.